Good morning, everyone. Thanks for joining us. We're just going to give it a few minutes just to let other people join the session, and then we will get started. Also, sorry if anyone can hear that. My dog has just taken this moment to have a really big drink, so. Wow, thirsty. Morning, everyone. Just for anyone else joining, we're just giving it a couple of minutes to let people join us. Yeah, and we will get started in a few minutes' time. Morning, morning. Okay, so I think we have a good number of people joining us now, so we'll get started. I'm sure anybody else who joins us in a couple of minutes' time will be able to pick up where we are. So good morning, everyone. Thank you so much for attending this webinar in conjunction with NHS providers and Patchwork. So we're going to be talking about effective rostering in action today, thinking about our kind of rethink the rota purpose here. So what we're going to do this morning is I'm going to give a bit of an introduction to the session, to myself, and then I will hand over to the attendees to do their own introductions. Just some housekeeping as well. You will see, I think, everybody's cameras and microphones are off, but you hopefully are all familiar with Teams. But if you're not, there's a chat function, there's a Q&A function. Please, we love these sessions to be super interactive. So please ask any comments you might have, pop them in the chat and we'll make sure that we get to them at the end. We've left lots of time for Q&A. So with that in mind, good morning, everyone. Welcome. So this is a webinar hosted in conjunction with NHS providers in collaboration with Patchwork Health. We're super excited to have you here today. Thank you so much. I think it's going to be a really engaging and insightful discussion. We've got some really exciting people on the panel today. So with that in mind, during the session today, we'll be delving into how the right rostering technology in place can have a significant and really positive impact on not just workforce retention, but thinking about recruitment and productivity as a whole. This is a really critical topic. I think, many of you on the call hopefully will know as well. It doesn't affect just NHS staff, but also the quality of care that we're able to deliver to patients. So before I go any further, I just wanted to introduce myself. If you're thinking, who is this lady speaking to me this morning? So my name's Lou. I sit within the product marketing team at Patchwork, and I've had the privilege of working within health tech industry for many years, supporting the NHS directly. Actually, prior to that, I was a clinical scientist by background, so I worked in genomics for a number of years. And my experience kind of led me to join Patchwork just over 2 years ago, as I really did believe, and I still do believe at that our mission is really crucial. And that is to help improve outcomes for NHS organisations, their staff and patients through innovative technology to achieve kind of effective and sustainable staffing. So with that in mind, for those of you who might not be familiar with what we do, Patchwork is a health tech company dedicated to helping the NHS and healthcare providers better manage their workforce. We do this by providing flexible and intelligent rostering, but also temporary staffing and reporting data solutions that empower healthcare staff to improve retention and optimize service delivery. Before we dive into the conversation and I introduce our fantastic panel of Patchwork leaders who are joining us today, I just wanted to quickly set the scene around the current challenges we're looking to solve. And I know, obviously, for many of you on the call, this won't be a surprise to you, but I think just helpful to kind of put the conversation in context. The NHS is currently facing a significant workforce crisis. So to put this into more perspective, the NHS saw over 140,000 staff leave the system in 2022, and 44% of NHS staff survey respondents frequently think about leaving their current role. So those are some big numbers. Just taking a second to take that in. 140,000 staff leaving the system 2 years ago, and nearly half of respondents thinking about leaving their current role. And to add to that, we're spending nearly 3 billion a year on temporary staffing to fill those gaps. So while there is a clear indicator of the strain on the system, and that can maybe make for disheartening listening, I guess, as a statistic, there are changes we can make to manage our workforce to help us improve satisfaction and retain those valued colleagues. So really all is not lost, and that's why we're here today, to have this conversation. So one of the ways that we can do this is by making the most of staffing technology to ensure that clinicians are deployed in line with true service needs, while also being empowered with flexibility and autonomy to help them remain in their roles and remain happy in their roles as well. So throughout today's session, we'll explore how this can be achieved through the use of Patchwork's technology and services, and we will touch on some real-world examples of how NHS trusts have successfully implemented our solutions specifically to address these challenges. So thank you again for joining us. With that, let's get started and introduce our panel. So the format for today, panel discussion, I'll be asking some questions and kind of leading the discussion, but yeah, it's really over to the experts that we've got with us today. So yeah, panel, if you want to introduce yourselves, name, role, short explanation of kind of your responsibilities and your background with related to workforce tech. So how can I see on my screen? Shall we start with Dan? Where are you?
Yeah, sure. Hi, good morning, everyone. Yeah, my name is Dan Chilcott. Nice to meet you all this morning. So my role here at Patchwork is the Director of Client Enablement. That role essentially allows me to support multiple parts of our business here at Patchwork. So prior to joining Patchwork, had the privilege of spending about 12 years working in a number of NHS workforce management roles. I've supported a number of different NHS organisations up and down the country as I've moved around sort of quite a bit. Hence why I've got a really bizarre accent. It's quite southern with some northern twangs every now and again. But essentially, I've been really lucky to support like a number of system-wide implementations of different health tech solutions, and working in workforce management to drive a lot of efficiency. So I bring a lot of that knowledge to Patchwork, and really support as a bit of an SME for our product teams, and then also support a number of our clients through their onboarding and ongoing partnerships with us as well. So great to be here today.
Perfect. Thank you, Dan. Shall we go from left to right across my screen? So I've got Alice next to Dan.
Hi, Lee. My name is Alice Roche. I'm the Director of Support Operations at Patchwork Health. So what that means is I look after the customer care team and ensure that everybody interacting and using our technology is happy, that their queries are answered, in a compassionate, empathetic and timely way. My background is predominantly health tech. So yeah, I've worked for other tech companies that have their software in NHS trusts. So have an extensive background of going into hospitals, making sure our tech is implemented. And and now I'm at Patchwork and really excited to be here, and the mission, really believe in. So yeah, thank you for having me today.
Perfect. Thank you, Alice. We've got Rich next.
Hi there. Hi everyone. I'm Richard Lucas. I'm the Client Analytics Director for Patchwork. So that means I look after our data function. So I have a fantastic team of data engineers, data analysts, all who have health tech experience as well and have worked with the NHS. Personally, I've been working alongside the NHS for about 20 years. I've spent a few years working within the NHS in various rostering roles, but I've also worked with trusts up and down the country looking at medics contracts, medics rostering, agenda for change, rostering, safe staffing, patient flow, all sorts of different things in various different consultancies and health tech providers over the last 20 years or so.
Right, thank you, Rich. And last but by no means least, Elisenda.
Thanks, Lou. Hi, everybody. I'm Elisenda Kuchen. I'm the Director of Product and Design here at Patchwork Health, which really means that at Patchwork, I'm responsible for setting the strategy across our multiple products of what we should build to meet the evolving needs of the NHS and our users. Importantly, that really translates into me and my team spending a lot of time with our customers in trusts, understanding what are the actual challenges people are facing in reality on the ground, and then bringing that back into the organization with our engineers and saying, okay, what solutions can we be building to help solve those real world problems in a way that's fit for purpose? My background is in, like many of the folks on this call on our panel, is in healthcare software, product management for over a decade, some of that within the US healthcare system. I then escaped and have been here in the UK working with the NHS, solving the NHS's problems through software for several years. And I'm thrilled to be here representing Patchwork.
Thank you so much. Yeah, great to hear from everyone. So with that in mind, we will kick off, but just as a reminder from a housekeeping perspective, there is a Q&A function, there is a chat function. Please do ask your questions, add your comments, your thoughts. We really want to hear from you to make this super interactive. As much as we love hearing from the Patchwork people, we love hearing from you guys as well. So with that in mind, we're going to start with Dan. I'm going to come to you. Dan, I mean, you mentioned about your kind of extensive NHS workforce management experience up and down the country, some north, some south, leading to the in your words, unusual accent. I would never say that about you. But can you share from your perspective, how has Patchwork kind of uniquely addressed the specific challenges that NHS trusts face in rostering its workforce?
Yeah, no, absolutely. So I think, again, as a lot of the panel have already mentioned, a lot of us within Patchwork have originated from the NHS. So I think it's really, really fair to sort of like start the conversation by saying there's a wealth of like internal knowledge sort of like ingrained into Patchwork itself. And that actually starts from sort of like our co-founders as well. So basically our two co-founders, both junior doctors, both sort of identified sort of like struggles within sort of the way in which they were trying to actually book locum shifts like as trainees themselves, and that sort of like kick-started sort of like Patchwork Health back in sort of 2017. There are many people within Patchwork who have got sort of like NHS experience as well, and I think that kind of like drives a lot of like the passion and a lot of the mission around who we are as a company. But I think sort of moving on aside from sort of like the people itself, what we've really tried to do differently at Patchwork is to truly try and fully assess like the whole of market, to really understand sort of like what systems are out there already, and then what systems are currently sort of like missing, and what organizations are not able to like get hold of currently as well. And I don't want to sit here and speak badly of like any of the other solutions like on the market, but what we've been able to really identify is that there's almost like two kind of like core groups of, or two categories of systems in the workforce space at the moment. And we've been able to sort of identify these, one being a truly highly configurable system, which does give organizations a lot of control and a lot of governance. However, with some of those controls and some of those governance, it does mean that the systems are really complicated to use. It does mean that the adoption and uptake of those systems can be like quite challenging. And actually that means that there's a lot of like sunk cost in the systems that have been purchased, which aren't being utilized. On the flip side of that, there's a group of systems which exist, which are highly specialized in meeting the needs of specific subspecialties. However, with those systems, they're not necessarily scalable. They're not necessarily able to be implemented trust-wide, which means organizations have a very fragmented approach to the different tech that they're trying to use. They also struggle with some of like the integrations through to things like ESR, or to sort of like your BI reporting tools as well. The thing that we've done differently at Patchwork is we've tried to find that true kind of like Goldilocks solution. I can see Alessandra laughing at me because I'm not sure she's happy with me using that phrase, but it's almost like that just right sort of like configuration, where we want organizations to have the control and governance, but we want that to be easy and simple and sort of like less clunky. So again, the adoption rate and the learning rate of how to use a system can be greatly improved. But we also want to have enough unique features to allow for some of those nuances, be that activity-based control, sort of like self-rostering. And sorry, Alexander, I'm probably stealing some of your limelight and what you're going to be talking about later on. But essentially, having sort of like the requirements across the product. So essentially you have one solution which can handle all of these different nuances, and also really sort of thinking around how we can bring together lots of different complicated workflows into one sort of like true kind of like single solution. It's really making that adoption as easy as possible. And I think some of the other things that really sort of like stand out, and again, I don't want to steal anyone's thunder in what's going to be said later on. So Alice and Rich, I'm sorry about this, but there's some really true exciting things that we've done around our partnership approach to like how we actually sort of work with customers, and then also sort of like some of the data that drives some of those ongoing partnership-based conversations as well. So there's some of the things that kind of like really sort of make us quite unique.
Yeah, I think that's yeah, you've touched on kind of like a lot of elements there, which I'm excited for different people on the call to kind of dive into. But I'm interested in from that kind of discussion of Patchwork's approach, which of those things do you think has built the strongest trust with NHS organisations? You know, why do people choose us? Why do they trust us with their rostering solution?
Yeah, no, I think it's a really, really good question, actually. And I think this sort of like stems back from sort of like who we are as a company. So essentially, we sort of launched in 2017, and originally we were just providing like temporary staffing provisions. Over the years, that temporary staffing provision has gone from being a single trust temporary staffing bank system, booking locums and doctors only, to now working sort of across all staff groups. We've been able to introduce collaborative banks to allow organisations to connect multiple organisations together across all those different staff groups. And again, with a couple of different models there around how we do that, either through lead employer or distributed. We then expanded functionality to then think about that sort of like ongoing supply chain through to agency, with some really, really fantastic agency controls, which can work with both sort of like in-house or through managed service providers. We've really thought about that. And through some of those conversations that we're having, it was quite clear that from sort of like I think there's like 57 customers that we've got currently serving 100 different organisations, 100 different hospitals, sorry. They were basically asking us, when are you going to tackle rostering? Because we know that there's a gap there. So a lot of this came from there being a clear sort of like market need for it. And essentially, with some of that foundation, what we were truly able to do is to then sort of work with a couple of small sort of like piloted areas in a very, very sort of controlled way, and start to build out sort of what we thought would be a really good MVP. The bit where that trust comes in is I guess some of the key things that we've been able to do is we were really, really sort of like empowered by some of like the feedback and by some of the suggestions which came from our customer. And again, I know that someone's going to sort of touch on how we work with customers in a particular way, but ultimately really, really thinking about, have we built the right thing in the first instance, or do we need to pivot and change? And actually, we've recently undergone sort of like quite a large architectural change within our platform to really allow future expansions, like how we build. And that's been done in sort of like collaboration and conjunction with a lot of our customers as well, to sort of like really sort of like set up that success. So I think a lot of it comes from just working really effectively with customers, listening to the customer voice and responding to the customer voice, as well as using sort of like our really, really highly skilled sort of like product design engineers and the wealth of like NHS knowledge which lives throughout the Patchwork company as well.
Yeah, thank you, Dan. I think that story that you told there of kind of our move from temporary staffing to the rostering space, one of kind of organic growth, is a really nice one to think about how we identified that need and then went to meet it. So with that in mind, you mentioned obviously Patchwork supporting kind of over 100 organisations at this point. Obviously, we have a lot of success stories. Every partnership is really important to us. But does any particular success story kind of come to mind when you think specifically about improving workforce management through changing perceptions of rostering?
Yeah, absolutely. So, John, there's a couple that I want to sort of like make reference to, if that's all right. So, we've been working with Royal National Orthopaedic Hospital, or RNOH, for a number of years. So they were using us specifically for their temporary staffing provision. Now, they're a highly specialist orthopaedic surgical organisation, and they were really facing challenges around some of like their rota gaps, around how to get specifically trained clinicians into particular gaps. So we've been partnering with them, and we've been able to massively streamline the way in which their rotas have been created and how they're managed as well. So actually, some of the information that they shared was that they used to spend around 5 hours sort of creating a rota, and that's been reduced down to sort of like 30 minutes. And that's like the initial rota at the start of like a core rotation. And then like the ongoing management of that has been massively reduced as well. All of these reductions in time is great for productivity, but it also is much less stress and much less pressure for the clinicians at the heart of it as well. So it really does sort of like pull on sort of like really sort of working towards improving like the clinician experience, which in turn massively sort of like improves like the perception of how they are, their likelihood to stay or return to that organization, or even attracting new people into their organization as well. In addition to working with RNOH, we've also been working with like North Cumbria Integrated Care. And again, sort of prior to them using Patchwork, they would say that it would take them roughly 8 hours to sort of like produce like an initial rota. And they'd also be spending anywhere between sort of like 3 to 4 hours a day managing the rota, sort of like in an ongoing basis. And that's been tremendously sort of reduced as well. And again, with both of these organisations, they're not just looking at what shifts people are working, but also what activities they're participating in. So actually within the one solution, they're able to sort of design a rota, create a rota, manage the assignment of different activities, handle like different like leave requests, all within like the one single solution. And the clinicians have got a single source of truth, making their lives at seeing where they're going, what they're doing, much, much easier as well.
Thank you, Dan. Yeah, two really, really strong examples there. Quite different situations, but yeah, that on that theme of kind of productivity. No, that was super interesting. Thank you for talking us through that, Dan. I'm gonna hand over now to Alessandra in a second, but before that, I think, yeah, as I said, we like to make these sessions as interactive as possible. You will have seen in the chat, we've shared those case studies for anybody who kind of wanted to read them further. But we did just want to put out a little bit of a poll, just to get kind of some audience participation about what the biggest challenges your organisation faces with current rostering practices. Dan shared there some of the challenges that RNOH shared, and NCIC as well. But yeah, we're really interested to know kind of whether these resonate with you or whether there's something different that you're struggling with. So yeah, we really appreciate any responses to that in the chat as well, and you would see that pop up as well. So just give you a second to share your thoughts there before I hand over to Alessandra. Okay, perfect. Amazing. Thank you so much. Okay, so Alessandra, I know Dan kind of touched on some of the things that I think you're going to talk to us about now, but I wanted to kind of ask you specifically if you could walk us through what key features and kind of the approach that that Patchwork's taken to rostering technology, and how do we specifically cater to the needs of NHS organisations as opposed to, I guess, some of the rostering solutions that are on the market.
Yeah, happy to. And it's a good thing Dan did touch on similar themes. I think at Patchwork where it's quite nice that we've been able to sort of stay collaborative and as Dan said, bring a lot of information back in and inform each other about how our approach works. But you heard Dan talk about the expansion of our products. So starting in the temporary staffing world and through discussions with customers and market requests, expanding to multiple products. And throughout that process, the core pillars have remained the same for Patchwork, which is that with whatever we build, we've been focusing on how do we increase flexibility, how do we decrease staff burnout, and how do we reduce the administrative burden of workforce management. And so for our rostering technology, this means we've prioritized things like automation and machine learning to make rostering and compliance more automated. You heard Dan talk about that example of one of our customers being able to reduce the time to roster to 30 minutes. With our focus on things like automation and machine learning, that gets shortened even further. And that's our goal, is really reducing that administrative burden, increasing the efficiency so that, as Dan said, we're making it easier for individuals to do their jobs, to have that job satisfaction, to be retained, and to help with the productivity of an organization. We've also focused on functionality that puts demand and true service needs at the center of planning. We've done this through several of our features and functionality within rostering. Specifically, one of them is our service plans, which drives the whole creation of our rosters and is what makes it so simple and puts the needs of the service right at the center of it. And fundamentally, we believe that rostering, although is one word and viewed as one tool, it encompasses many, many things that both clinicians, workers, and administrators have to do. And that tool should be a place where clinicians and administrators can see all of the information they need. They need to be able to do that intuitively, whether that's leave or self-rostering or shift swapping or exception reporting on both sides, the information that needs to be seen for those things. That should all be available really, really easily and in one place. And the goal is that through all of this, we're making the lives of all of our users simpler with clearer information at their fingertips. So it ties back to our core pillars, which have never changed across our products. But for rostering, we've really focused in on what are the components that are going to reduce that administrative burden and increase that flexibility for our users.
Thank you, Alessandra. It's super interesting to hear you talk through that, and happily as well. I think that resonates with some of the responses that we've got on the poll, thinking about inefficient use of resources, which I guess is really closely linked to reducing that admin burden, but also, yeah, rostering as a tool to provide flexibility for the staff is really key. If you think about what we've done up to date and kind of what we're working on now, how do you see that the Patchwork can ensure that our solutions remain adaptable and scalable to meet the varying needs of different NHS trusts kind of as we scale and expand?
Yeah, that's a great question. That's a really hard challenge for any software company to face in almost any industry. I think at Patchwork, we've spent a lot of time thinking about how do we specifically go in there and solve that challenge. You heard Dan talk about the Goldilocks solution. How do we make sure that we're right there in the middle? I think to put a finer point on that, we know from being out there with our customers, from the experience of our internal folks, that the challenges faced by trusts are very interconnected. Yes, it is true that specific services and departments have nuance, need configurability. They need our products to cater to some of that nuance. But activities, decisions, data in one area does impact activities, decisions, and data in another area. And often, even more so now as we think about productivity, trusts are looking at overall metrics, overall analysis, and resources. And so it's really important for us at Patchwork to be thinking about and designing our products with that holistic view in mind. And that's how we continue to achieve that Goldilocks solution. And I think that that's what makes us very adaptable and scalable. We have that holistic view. We can dive into the areas that might need some nuance, configurability for that specific area, but we know how to and the importance of tying it back to the holistic product so that you don't end up with Frankenstein solutions. And so we focus on building solutions that way. The solutions talk to each other. They talk throughout the trust. They support the workflows throughout the trust, not just in that one area. I think I'd also touch on and bring attention to some other things that Dan also mentioned, which is the need for the voice of the customer and user-centered design. So what that really means is that my team, our engineers, our implementation, our customer care, everyone within the organization spends an incredible amount of time with our customers, whether that's on site, on video calls, through surveys, but to really gather that voice of the customer. And then we take it a step further, which is to say, when we're designing the solutions, we need to make sure that what we're building isn't just fit for purpose in the theoretical sense, but actually on the ground when it's being used, when the realities of constraints and how humans actually behave are applied to it. Have we designed something that works with the humans that are going to be using it at their center? And by designing in that way and using the voice of the customer in that way, that makes us, I think, it makes our products much more adaptable to things that change and allows us to react a little bit more quickly.
I think that point you just made there about kind of user-centric design, making sure that you have the voice of the customer. I wondered if you had any thoughts on, I guess, like getting it wrong. You know, how do you know? how do you learn from that from a product perspective?
Yeah, so great question. We do get it wrong. Every software company gets it wrong. I think the difference is, I guess I'll add in that we sort of have an agile modern development system for Patchwork. One of the advantages that Patchwork has, the privileges, I suppose, that we have, is that we have a technology stack or an underlying platform that's much more modern than some of the other solutions out there on the market, which means that we can build in a more modular way. We can build in a more iterative way. And you heard Dan use the term MVP, sort of minimum viable product. And really that reflects our approach to solve for this exact problem, Lou, which is that we believe in developing iteratively. So we can understand that there's a problem about this big, and we'll say, okay, let's build about half of the solution for half of that problem and get it out to our customers as quickly as possible. We know it won't solve the full problem, but by getting it out quickly, we can see, first of all, are we on the right track? Is it solving something? And is it solving it in the way that our customers need and want and can use? And then very quickly, we can get feedback. If it's not solving it in the right way, great. We only spent 3 weeks and we got something out the door and people were able to look at it and use it in real time. We can shift gears and get something that is much more fit for purpose out in the following 3 weeks. If we are on the right track, it gives us ample time to take the feedback from our users and embed it into how we continue to build it, right? So if I think about how we've approached self-rostering, we have gotten so many different customers to tell us about how they do self-rostering. What are the differences? So we could find how to make it generalizable, but also configurable in the right way. And there were a few times in those early weeks where we did not understand exactly what type of information people need to be looking at the time of self-rostering. And by speaking with our customers and being able to develop quickly, we resolved that and have gotten to a solution that is much more fit for purpose and avoid the big failures that can happen. We really look at how do we find the small failures at the very beginning so what we build is better for everyone.
Super interesting. Thank you for sharing that. I think we've kind of touched on there a lot about the approach we take from the product itself, and I think what we're going to kind of hand over to next is Alice to talk a little bit about the service and kind of how those things are interconnected. Before we do that, thank you so much for all of your responses on the other poll. We have another poll for you because we want to kind of understand. We've touched, Alessandra covered there about user-centric design and voice of customer and how we can make sure that the product is really supporting or alleviating some of the challenges that you face. But we want to understand what challenges have those on the call faced with training and support from their current rostering solution provider. And while I just give people a few seconds or a few minutes to respond to that, I asked a question on the chat. Alessandra, you mentioned about kind of metrics, and I wondered, if there were any thoughts on the call from people about what metrics there were a current focus at their organisation. And I see we have a response talking about fixed rosters issued to staff 6 weeks in advance. Dan, I wondered if you had any thoughts on that, or Alessandra, about that as a metric. What are your thoughts there, and kind of from just broadly, or thinking about how Patchwork can support that?
Do you want me to take it, Alessandra?
I'm happy to. I was just going to say, I think as a metric, it's something that we look at internally too, because part of what for us that tells us is about how well our rostering tool is helping services and departments plan ahead. And by planning ahead, we have a lot of our own internal data, especially when organizations are using rostering in conjunction with our bank, that by planning ahead, they're more likely to identify gaps and more likely to be able to fill those at a cost that is better for the organization. And so that was my only thought, is that yes, we are fully supportive and look at that metric internally as well.
Yeah. So I was just going to add to it and say sort of the way in which that we have built our solution is probably different to what a lot of customers that are on the call might be used to sort of seeing as well, in terms of the way how other systems work. We're sort of taking our approach in a slightly different way in terms of making sure that our system is fit for purpose for all staff groups. So considering that the way in which we roster nurses is very different to the way in which we roster allied health professionals, which is very different to the way in which we roster junior doctors and consultants. There are lots of different staff groups which exist, which all have got these unique ways of working. We've tried to create a solution which essentially allows for all of those different types and ways of working to be consolidated into sort of one single view. So Alessandra touched on the fact that we've been recently sort of working on sort of our self-rostering sort of based approach, which is then going to allow departments to be able to sort of set up windows and periods of time in which people can sort of put their preferences in, and then within a couple of minutes then generate a full rota sort of based on the back of that, really supporting that speed and time it then takes to kind of capture all of the requests in an effective way and then deploy deploy a solution which is then going to meet the needs of the staffing requirements and the preferences of the individuals themselves. All of that is then sort of like backed up with data. And I think that's the bit that's really important. But not only can it do that, but it could also work that alongside people who are maybe working on fixed patterns for sort of like indefinite periods of time, or even for like shorter periods of time. So we can accommodate both of those needs like in the one solution. So it's not just a case of having, here's 4 weeks and we focus on that 4 weeks and then we start on the next 4 weeks. You can have rosters down for the next 3 years if you wanted to, and then decompartmentalize that. And this is like our way of thinking is, how do we accommodate all staff groups in this one single solution? And that's what we've been able to achieve so far.
Thank you. Rich, I deliberately haven't come to you because I know we're going to come to data later, but hopefully maybe you can keep that metric in mind and we can kind of touch on that after we've covered some of the service elements too.
Definitely. I was itching to get a word in, but I'll let us go on to that.
Giving you a full platform. Yeah, okay, perfect. And so with some of those poll results in mind, Alice, I don't know if you've seen in the chat, but overwhelmingly lack of ongoing support is something that has been identified as a challenge in current rostering providers and their approach. So yeah, I think with that in mind, let's turn to kind of the service and support element. So Alice, I wondered if you could just kind of describe to me what our implementation process is at Patchwork. So how do we work with NHS trusts, and also how do we kind of ensure a smooth transition with minimal disruption to daily operations as well?
Sure, yeah, I'd be happy to talk about that. So we use a Prince to Agile approach. So for those that don't know, that's a popular project management methodology. And essentially what that means is we really favour regular clients and patchwork, partnerships and interaction over complex governance. So we really approach it with 3 stages. So that's initiation, delivery, and closure. So in the initiation phase, we really, think about risk first. We ensure that we have alignment on contract deliverables, standardized documentation, and this also goes for establishing process changes and helping to, support with change management and communication within the trust. So that's like first and foremost how we would approach it. And then we have, the delivery, which is the large chunk of the implementation. And that's, I suppose how we reduce the operational impact on the client is by managing the project in weekly sprints. And we only pull in the required clients as and when we need them. So, to reduce the burden on them. And in addition, where we can lead the project and activities we do. So our app will enable a higher level of autonomy for certain features. So for payroll queries, instant booking on our temporary staffing side. And this really reduces the admin burden on our client. And we really believe in the strong governance of regular meetings, multiple stakeholder group meetings, including, clinicians, rota coordinators and managers, and monthly steering groups. So it's really about having everybody bought in, everybody aligned. And I think that naturally leads me into the training and ongoing support. We really, recognise that as a problem for organisations. So we like to offer support by FAQs. We have an online help centre. We have really comprehensive FAQs, but also we support with how-to videos. And we also have my team, which is the customer care team. So we have live chat, phone support, email support, etc. But yeah, it's very much, following on from what Elisenda said, and also Dan, it's really user first. It's really listening to the problems that the trust are facing, and then trying to work out how our software and our tech can solve those problems and making it configurable to them, because it's not a one size fits all, right? Our product, it can be configurable to them and their needs. So yeah, that's how we approach our implementation.
Thank you, Alice. It's super interesting, I guess, to hear it broken down in that way. I wondered, actually, I know that we shared the link earlier and Dan mentioned it, but what came to mind there is NCIC. I think there's a lot of stats in there that really kind of resonate with the impact of our approach and kind of how we get people kind of off the ground quickly. I wondered if you could kind of talk a bit more about what types of kind of specifically ongoing support and training Patchwork Health provides to our NHS organisation. So how do we really maximise the effectiveness of rostering technology on an ongoing basis, not just at that initial point?
Sure. Yeah, NCIC are a lovely one to refer back to. I just love some of those stats, you know, managing rosters and getting it down from 5 hours and it taking 5 hours to 2 hours, or, you know, getting the leave approved down from 5 weeks to just then 3 days. It's yeah, absolutely incredible. So with the ongoing support, so when we approach our implementation, we have something that we call a hypercare phase. So our implementation team stay with the trust around the go live date for a few weeks to just really ensure support of the users and workers and make sure that, you know, they're not just abandoned. It's not like we've been with you this whole time, now off you go. So yeah, so we have, you know, a really blended approach of a hypercare period where we really look after them. That can include on-site and online training. So when we have a client go live with us, we can deploy people to be on site with them. And also in terms of our rostering product, this really extends to a train the trainer model, so support the building and management of rosters. Ongoing webinars are a nice way that we, you know, continue to share best practices, hints, tips, and also overview new functionality. And like I said, we also have our customer care team and we have the live chat support, the, you know, phone calls, emails. But it's really about making sure that people feel that we're there. It's an extension of the trust. It's a partnership. That's how I like to view it. And I know that that's, you know, the thinking of Patchwork as well. So, and I think that you feel that across everything, you know, from what Elisenda said about the user-centric design, you know, that's like a value of ours that's, you know, through all of our work, and yeah, certainly through our support and service too. I think you're on mute, Lou.
Sorry, I muted myself. I don't know if there's anybody else getting any feedback on the call, whether that's just me. Okay, perfect. So yeah, I think super interesting to kind of hear about those the different ways that yeah, Patchwork can kind of support not just initially but on an ongoing basis, thinking about the data, which I know we'll come to in a second as well, Rich. I guess thinking about collaboration and scalability, you know, one of the questions that I think I always ask myself is, you know, we have our kind of high touch service offering, we really do make it a partnership, but how do we kind of do that at scale? How do we collaborate with NHS to continuously improve the deployment and impact of our solutions, but at scale?
Yeah, sure. I think it goes back to treating it as a partnership. You know, we treat the work with the trusts and health boards as a partnership. We have regular quarterly in-person meetings with them. You know, once they've finished post-implementation, the hypercare phase, they get passed to our client partnership team and our customer care team. And then, you know, we focus on the continued delivery of the trust's business case or the reasons for partnering with us. And, you know, we drive the maximization of our technology, of the value of our technology and services. And we seek those opportunities to educate the users and senior leaders around best practice. And we focus on outcomes, you know, whether that be the financial challenges of the organisation and the challenges that they're facing, or the health of the use of our products. So the users' experiences, you know, and we actively want to understand the objective of the partnership from the organisation's perspective so that we can best help them deliver, you know, maximum value in all that we do. We focus on those regular meetings, partnership review meetings, and we, you know, try to get in person as much as possible. And in that, you know, we focus on data. We focus on, you know, interrogating the data, making sure that, you know, that they're getting the best out of the partnership. We're sharing with them how our technology is helping them to achieve, you know, the needs and the goals that they had. And, you know, I truly believe, to echo what others have said on this call, that we understand the challenges that the organisations are facing, having that vast experience across the organisation, you know, from within the NHS or, you know, health tech roles. So yeah, I truly believe that that sets us apart as well. But I guess the takeaway would be that I see it as a partnership, and we're an extension of them, and our job is to, lessen the load and the burden, and we need to be continually showing them the impact of choosing Patchwork.
Yeah, you mentioned there about partnership reviews and kind of making those data driven. So that does feel like a good time, I guess, to turn to the data and thinking about that more specifically. We have one final poll for everybody just before I hand over to Rich about how effectively your organisation is currently using data to inform staffing decisions. Obviously, everyone on the call from a Patchwork perspective has highlighted how we are hugely data driven internally. It informs not just our product decisions, but our service decisions as well. So with that in mind, we would love to know kind of where you are currently, and I will turn to Rich. Rich, I would love to know, could you expand, I guess, a bit more specifically on how Patchwork leverages data to provide actionable insights for NHS Trust? So how are we using that data to improve workforce management and ultimately patient care?
Yeah, definitely. Alex has set me up really well there because we really do.
It was intentional.
Of course. We're really passionate at Patchwork how data can really be used to drive that sustainable long-term improvement. If you're aware of how transparent of what's going on with your processes, be it rostering, be it temporary staffing, be it agency management, whatever kind of workforce process you're looking at, then you can really drive that improvement through and in a very informed and sustainable way. So we've built a suite of data products that kind of support and complement the systems that we have and the technology that we've put out there to really allow people, both ourselves and our clients, to look in depth at those processes and make sure they are effective and as efficient as they possibly can be. So the first of those is our MI platform, Patchwork Insights. So this is a platform that we give access to with all of our products so that clients can log on and explore their data and ask questions of that data and look at that and make sure that they're really getting the most out of it. So we do that because the platform itself is very accessible. So you don't need to be a data person. You don't need to be able to build massive pivot charts in Excel or explore data in other ways. It should just be very easy to understand and very open to everybody. And that openness to everyone, making sure you can share it easily across the organisation. The platform could be logged in, shared with as many people across the organisation as you would like, and really support that knowledge transfer and have everyone singing from the same hymn sheet there. Our dashboards all are very adaptable as well. So as with the product, and as Alessandra was saying, we appreciate there are nuances in how people are using what we do. So the data analytics that we provide is very configurable, so you can drill down and you can filter it to make sure you can explore your data and really dive down into the really actionable insights that come from those. And then we want it to be appropriate as well. So sufficiently detailed to allow you to really get to the bottom of the issues that are being flagged in your key metrics, but also current enough to be operationally useful. So our MI platform refreshes itself on an hourly basis. So it works on an almost real-time basis, so that you can make operational decisions based on the information that you can find in there. And we set it up so that different people across the organisation, different stakeholders have access to the kind of data they need, whether that's an exec summary or whether it's a really detailed, deep dive set of analytics that allows you to really interrogate that. So that's our MI platform, Patchwork Insights. We also then have various data connectivity tools that allow for the transfer of data. So we like to think of ourselves as hyper interoperable. So we can automatically push data to downstream tools and downstream data repositories, whether that's Trust's own data warehouse and own management information tool, or whether it's downstream systems that can use our data and move on from having to have double key information and really take advantage of data transfers. We can also consume non-patchwork data. So where appropriate, we can take, say, ESR data or ledger data and combine it with our patchwork data sources and create bespoke analytics for clients if that's something that they're interested in, something that's useful for them. And then finally, we're really exploring the emerging data technologies. Everyone's talking about AI, everyone's talking about machine learning, but behind the hype of those things, there's some really useful technologies to drive things like predictive analytics or forecasting to allow for proactive decision making. So let's not be reactive to what's already happened. Let's look ahead and try and impact things before spend is actually spent, money is spent on things. So all of that allows, we think, our clients and also ourselves to make really data-driven decisions. So the areas that they need to focus on are really clear. Success across your organization can be really clearly articulated and celebrated indeed. And we can see our clients moving from kind of just producing data and just the workload of having to pull data together and identify insights to a place where you're truly understanding your process and using the information coming out of it to really drive improvement.
Oh, thank you, Rich. It's super helpful to have that kind of overview of Patchwork Insights as an offering. And I can attest that it's, even if you don't know data very well, it's easy to use, because I am one of those people. Even I can use it. So
we have Auntie Joyce. One of my teams, Auntie Joyce, is the person at the back of our mind that we always think about when we're building dashboards.
Amazing. I think it's super helpful to kind of hear how we envisage Patchwork Insights being used to drive data-driven kind of workforce improvements. But do you have any examples of these that you can share? Because I think that's always helpful for people to kind of hear how other trusts are using this.
Yeah, definitely. So my experience that when you're looking to drive improvement through kind of the use of data and the use of reviewing a process, it's best to have that information regularly consumed by and challenged by some really senior stakeholders of the organisation. As part, it could be a delegated authority to do that, but where you have a regular consumption of data and a regular process for driving that adoption and review of information, that's when you get just organic improvement across the organisation. As soon as someone knows they're going to be asked a difficult question, they will take extra measures to make sure the metrics are reflecting what they should be. So in terms of being able to do that, there's a couple of kind of foundations you have to have in place first. So first of all, data needs to be open to all, as we have with Patchwork Insights, and it has to be really transparent and consistent as well. Consistency is really key. So all the stakeholders across the organisation need to be aware that your performance is going to be looked at, and it's going to be looked at in the same manner on a regular basis. And if that can be shared amongst peers as well as kind of senior authorities, even better. One of the other ones is being able to set appropriate goals and being aware of the context that you're working in. So having local comparator information as well as national comparator information to come and say, how much are we an outlier from the norm here? What is a reasonable expectation to do? And not trying to solve every problem at the same time. Break it down, chunk it up, and focus on those key drivers of the performance that you're looking at, and then establish good practice and then move on, but keeping half an eye on the data so that you can identify if it's slipping as well. And the last foundation I would say is really celebrate as well as challenge. So focus on where you've got trends rather than single point changes. And that's really what we've tried to do with Patchwork Insights is give a good trend information, allow people to spot trends and spot changes to the whole process, the whole system, rather than just month-on-month differences. And we've seen some clients be really successful in kind of understanding that context and using something like our comparison dashboard to understand how other organisations are performing in their area. And one of those has been kind of Homerton Hospital, have really got to grips with that comparison dashboard and and really using it to challenge back things like rates being paid to bank and agency, or lead times on rostering and bank shifts being sent to bank, to make sure that they're challenging appropriately and they're working in a contextual way and they're making informed decisions there. And the other one where I've seen a really brilliant kind of challenge process being driven by Patchwork data is at Warrington and Holton hospitals. So they set up a process where their medical director and their workforce information teams were working really closely together and using data from Patchwork Insights to ask questions of their operational teams and really kind of focus on the performance of their organisation with a senior stakeholder buy-in there. So I think we've got a case study for that one up on our website as well.
Amazing. No, thank you, Rich. I think yeah, hearing those two examples it really kind of puts it into focus. Yeah, the different ways that people are using our Insights platform. I'm conscious that we have a few minutes left, so I want to make sure that we leave time for any questions that anybody on the call has. So please do pop your questions in the chat and the Q&A. We'll also follow up directly as well if there's anybody who feels that they want kind of a deeper dive or they have any specific questions that they don't want to ask on this particular forum. So we'll make sure that our contact details are available for everyone on the panel. I think while I just give people a few minutes to pop any of those questions in the chat, Rich, I just had a super quick question that I wanted to ask you as well. You mentioned kind of about trends and thinking about kind of where Patchwork, the direction that we're going, where we've been and where we're going. Do we have any plans to kind of incorporate any more data-driven decision-making kind of capabilities?
Yeah, absolutely. It's an area that I'm really excited about. So I'm going to have to keep myself short here, otherwise I could talk for the rest of the morning on this. So we're already using machine learning algorithms to offer kind of future forecasting on things like temporary staffing demand and fill rates, and also we use data science and AI within our products to provide things like predictive analytics and removing some of the manual effort that Alessandra and Dan were talking about earlier when creating rosters. However, as I say, we're really looking to expand this area. So it could be through things like using generative AI to generate a workforce board report, or using a smart model to make shift recommendations to workers when they log into the app, or to people who are requesting shifts or need a worker to fill a temporary staffing shift. So and also the other thing that I'm really keen to drive, and I'm really excited about, is getting data into our products. At the moment, it's kind of you go in and explore your data separately, but we are starting to now permeate that data into our products at the point people are making decisions. So you have often kind of a really simple little nugget, a little point that might just give you that context around that decision you're making, and so really help to drive informed decision making when using our products. So yeah, I'm really excited about all of that area and looking forward to the future.
Thank you, Rich. No, it's super interesting topic there, and as you say, something that we could probably do a whole webinar on itself. So with that in mind, I just wanted to kind of wrap up today's session. I'd really like to thank every one of you, all of our panelists, for your kind of sharing your insights and your participation, those on the call as well for sharing your thoughts, participating in the polls, and just really helping us make this a super engaging and insightful session. I've learned a lot, so yeah, hopefully everybody else has too. So just to kind of sum up my takeaways, I think we've really explored kind of effective rostering technology and things, you know, how solutions like Patchwork can significantly impact workforce retention, recruitment, and overall efficiency within the NHS. And what I really like is that we've explored this from different angles. We've explored it both from, you know, product now, product in the future, data, service, implementation, all of those things, and how they kind of all come together. And it's complex. And so, yeah, I think it's really important that we take that kind of multi-lens approach. We've really focused on how flexible and data-driven approach not only addresses current challenges, but also prepares us for kind of future demands. And our discussions highlighted the importance of choosing a provider that not only offers that innovative technology, but also provides kind of exceptional training, support, and Alice kind of summed that up nicely, thinking about it as a partnership throughout the process. And yeah, I was encouraged, well, not encouraged, but it was good to see kind of that ongoing support was a real theme in that poll about the challenges with support. By leveraging these solutions, we can really ensure that NHS staff are supported, satisfied, and empowered. And ultimately, you know, we're all here to make sure that patient care is improved as well. So thank you again for joining us. As I said, we'll make sure that our contact details are available. I know there were some follow-ups that are kind of indicated in the chat as well. And yeah, we really look forward to continuing this conversation with each of you as we kind of work together to make that effective and sustainable staffing a reality for everyone. So thank you. Enjoy the rest of your day. Thanks for taking time to spend taking the time with us this morning.